My name is Bruce Ouellette. I'm originally from Rhode Island, moved to Maryland. I come from a French-Canadian background, and I've now been practicing dentistry, I hate to say it, but going on 37 years. Mainly I started my practice up north. I was there for about 3 years, but I've been in the Palm Beach County area since 1983. We are a general restorative practice, and a lot of patients really don't know what that means. Basically, we do general dentistry with a concentration on full mouth reconstructions or restorations, taking patients that have a lot of work to be done and rehabilitating their whole mouth, all the way down to somebody who just needs an exam or a cleaning or just a filling. In our practice, we have Dr. McLean, who serves children as well as does some minor orthodontia, and we have myself as well as Dr. McLean that sees adult patients. So we'll serve everybody from children all the way up to the elderly. You know, the uniqueness of our practice has come to the fact that when we meet a new patient, I have a personal interview with the new patient. It's my belief that patients come to us with an expectation and with a desire. So I will sit with them. I have 40 minutes with them to sit, evaluate them, have a one-on-one interview. We take them back into the clinical aspect of the operatory. At that point, I'll do a full examination. I'll do a head and neck oral cancer screening. We'll evaluate their gums. We'll evaluate their teeth. We'll go ahead and take a full set of photos as well as a full set of x-rays. The digital photos help me to come back in the future to reevaluate if something's changed on the patient. After that, I invite the patient to come back and see me, and we have a 20-minute consultation at no charge to go over all my findings. You know, the way I want my patients to feel when they come in here is that they're welcomed and they're part of the practice. They're actually part of our dental family. We make great strides at trying to get into relationship with patients to serve them and take care of them. And so that's the way I want them to feel. I want them to feel at ease, able to ask me any question they want to ask me, and that we know we're working toward their goals for dental health. I believe the reason that patients choose us for their dental care is we don't focus on a tooth. Many patients tell me, you know, Bruce, I come in here and you focus on the whole mouth. You look at one tooth and how it relates to the mouth, and then you take the work that I need and we fit it into their time restraints, their financial restraints, and also take particular attention to any fear values that they may have associated with dentistry. You know, I started calling my patients every night probably about 34 years ago, and I continue to do it. And I think it's very calming for me, and I also think it's calming for the patient. I can head off what might be a potential problem very early, or I can put their mind at ease very early in the evening beforehand if they're having any type of minor symptom that really isn't a problem at all. The greatest pleasure I get about being a dentist is twofold. One is to take that patient that needs work done, once again, to get into relationship with them and to serve them particularly for what they need. The other satisfaction I get is, I hate to use the term nailed it, but I really get great pleasure out of putting the dental work in and knowing that I've done an excellent job. It fulfills my analytical, I would say, personality. You know, keeping up with the new procedures and the technology and the advances in dentistry is quite a challenge because dentistry is changing so quickly, especially on the digital front. By being a lecturer internationally and also a consultant for certain dental companies, I get the ability to see this technology firsthand. I get the ability to put my hands on it right away, and we get the ability to use it here in our office. And I think it really fuels our fire in dentistry within this office to provide that for our patients. You know, teaching as I do, about 35 times a year, really gets me to be on top of my knowledge. I have to be more knowledgeable about the information than I've ever had to be. When it comes to my staff and my team, as I like to call them, I'm blessed. I have one employee who's been with me all 34 years that I've been here. I have other employees that have been with me 20 years, a couple of employees that have been with me 12 years. My team is really my team. They are the face of this office. I love to have them here. They've been with me, and hopefully they'll stay with me a long, long time to come. You know, if somebody's going to call our office and make an appointment, what I really want that person to know when they come in here is we're going to treat them individually. We run on time. We take our time to answer the questions. In fact, I actually have an employee who's designated to handle questions and talk to patients and set up the correlations with specialists to answer their questions at any time. So if I'm with a patient and I can't be disturbed at that moment, she can get on the phone, she can talk to them and handle their concerns in their time frame, not mine.